Sutherland, naturopath and FX Medicine Ambassador. Today I have with us fellow co-host on the podcast, naturopath Lisa Costa-Bir, who will be talking about her favourite herb at this current point in time anyway.
Yes, I'm excited to talk about it, and it is saffron, Crocus sativus.
So tell me, Lisa, why is this your favourite herb at this current point in time?
I think it's such a good mood elevator, and I think a lot of people struggle with feeling a little bit flat, little bit melancholy at times, and saffron just works really, really quickly to uplift the mood and make everything better.
And so what kind of person, or what does the clinical picture look like for you to then think, boom, this person really needs saffron?
Almost everybody that comes into my clinic gets saffron. However, I see a lot of patients with premenstrual dysphoric disorder, PMDD, so I prescribe it there. I see a lot of women with perimenopausal mood disorders, so I prescribe it there. There's a lot of good research coming out with use of saffron for dementia and Alzheimer's disease, so I use it there. ADHD is another area where it's quite well studied. So pretty much anywhere. Yeah, it's a great antioxidant for the brain as well. Yeah.
Okay, and so how do you prescribe it though? Like, do you prescribe a capsule, tablet? Like, what is the form? What kind of dose? And do you get any compliance issues? Is there any workarounds we need to know?
So a lot of people ask, can I just use saffron, as a food, as medicine as a herb in milk or in curries and things like that? I tend to find it's just not enough to do what we want it to do in terms of therapeutic effect. Still good to use it in that way, but I use a liquid extract, and I'm typically using a lower end of saffron, so 10 mils in a bottle, just because it is quite expensive, and actually a little does go a long way. I tend to find that it works very, very quickly. So within a couple of days, most people are feeling a change in their mood. And in terms of compliance, it's generally quite tasty. It's a tiny bit bitter, but not unpleasant. So it's actually a really easy one to get down. My only caution would be in patients with bipolar because of that excess serotonin that can occur with saffron. So some people may find that it creates bit more mania, so that's your contraindication for giving saffron.
I am busting to go and find some saffron right here. I want to try some. Thank you for such a good reminder on a herb that, I know it's good theoretically, but I just haven't got into the habit of prescribing it consistently and regularly. So I'm so inspired by you to go and do that now. Thank you so much for joining us.
Pleasure. Thanks for having me. It's nice to be on the other side.
It's always nice to be on the other side. Thank you so much for joining us. Please don't forget to jump on the website and have a look at all the incredible resources that we have at FX Medicine.